Home health care is a service for people who are eligible to get care at their home. And instead of staying in the hospital for extended periods of time or going to a short stay unit, sometimes it's appropriate for people to get care at their home where they can still have the skilled nursing services, therapies, help with their showers, and even long-range planning for the whole family provided by an agency in the comfort of their own home. We have two types of home health services. We have skilled or acute needs, and we have long-term care needs. For example, if a person recently was in the hospital with pneumonia and they were able to go home on antibiotics and continue healing at home, that would be a skilled or acute home health care episode, which is primarily covered under Medicare or a Medicare replacement if they're eligible. And that would include nursing visits. We would listen to your lungs. We would monitor your oxygen level and make sure that your infection is resolving at home and try to keep you out of the hospital and getting better at home. We also have long-term care where, let's say that this same person who was getting services for after having pneumonia in the hospital, they're all better now, but they really could benefit from the nurse continuing to come to help them with their medications. They could either have the option to privately pay for the home care services, or they may have another insurance that would cover it as well. There are home health care services covered by your Medicare. Home health is a Medicare benefit that a lot of people don't know about, and a lot of people also think that you have to have had a hospitalization in order to use your Medicare for home care, which is false. You can have a change in your health status, like your medication, a new diagnosis, and your doctor has to just call the home health care agency of your choice and make a referral. And then a home health registered nurse would be happy to come out and assess you to see if home health is appropriate for you. You can find home health care agencies by going to Medicare.gov, or I would just call your primary care provider and speak with the nurse of your doctor, and they will help you make a decision on which home care in your area would be right for you. On Medicare.gov, they do have ratings for the home care providers in your area, and it's based on a star rating up to 5 stars. Then you can also get information from other people on their experiences with a particular agency, and then you can make the right decision for you. There are so many benefits to home health care, and this includes being able to recover from an illness at home where you're more comfortable. A lot of people in the hospital tell me that they don't sleep because people are constantly coming in their rooms and there's alarms going off. I feel that people at home can get better as long as they're appropriate to be at home, and maybe they have a caregiver at home who can help them as well. We deal a lot with patients after they've had pneumonia because it's very debilitating and it takes a while for people to bounce back from that. We also see a lot of patients after they have had a surgery of some sort so that we can help them rehabilitate at home, monitor their incisions for infection, make sure their pain is under control, and just get them back to their normal functioning selves. So when we first go out to visit the patient, the first visit with the nurse takes a little bit longer. We have to go through their full health history, do a full health assessment, go through all their medications, and really get to know them so that we can develop a care plan that's very specific to them and their goals in getting better. And then when we make follow-up nursing visits, they can range anywhere from maybe a half an hour to an hour, sometimes more, depending on how that patient's doing and what their needs are on that day. Depending on the patient and their diagnosis, we may have to see them every single day. For example, if they have a wound that we're caring for that needs a daily dressing change, we would see that patient every day. We may have another patient who only needs weekly nursing visits. So each individual is really unique and we will cater to them and their needs specifically. The older adult can decide if home care is right for them by meeting with the registered nurse for that initial home care assessment, and then it's a mutual conversation to talk about what their expectations are, and with me as the professional and them as my potential patient, we come up with a plan of care that is appropriate for them, and we go from there. The process of getting home care services oftentimes comes from the physician's office after the patient has been seen for a visit and the physician sees a need for home health care. Other times an adult child or other family member calls the home care agency directly looking for help. And at that point, our office contacts the patient's primary care provider, and we get a referral to have the nurse go out and assess it in the home. Home health care is not just for the patient that we're caring for, it's also for the family and caregivers that are providing care to them when the nurse or therapists aren't there. So a lot of times we do have adult children sit in with the visit, especially if that person has dementia or some cognitive impairments, even hard of hearing. We love to have the whole family involved. We love to have the whole family involved so that we can serve the needs of the whole family and not just the patient. Many people aren't aware, including children of older adults themselves, and also just people of any age, that home health care is part of their benefits, and they don't have to be in the hospital or have a surgery, anything major like that. It could be something as simple as this patient has been having frequent falls, or you notice that mom and dad are not taking their pills correctly, they're not refilling their medications on time. Those are all reasons why you may contact a home health agency. And just remember, if you're not sure if your parent or yourself needs home care, you can at least make the phone call to an agency or your doctor's office and let that nurse come out and check it out in the home, and then you can go from there. I love being a home health nurse because I love to be able to see my patients when they come home and they may have given up hope a little bit, or they're a little scared about losing their independence, but then working with them and educating them and coming back and following up, they're actually able to bounce back a lot of times to their previous level of function. And even if they don't get all the way there, it's enough for them to maintain living in their homes independently and keep them out of the hospital and keep their chronic disease processes in check. Homebound status is a common misconception amongst people where they think if I have home health care, I cannot leave my home. So I just want to set the record straight that homebound status really means that it's not easy for you to leave your home or your adult parent to leave their home. And if they do, they typically need help from another person to get to their doctor's appointments. Or let's say they went shopping, they would not be able to go in the store, drive there, get out, get all their groceries, go back home, unload their groceries without being very, very fatigued. So we would still consider that patient as homebound even if they left their home. It really is their ability to leave the home and how they tolerate the outing. The goal of home health care is to keep a patient in their home as long as possible, keeping their independence, but also in a way that they are safe and managing their health care needs appropriately.